So I'm a sort of family member of an addict alcoholic, and so I have a lot of empathy for the families as well. What do you offer the families? You know, they're coming in struggling too.
Yeah, absolutely. You know, and people think this is a, and I thought the same thing. You know, that I'm only hurting myself. I'm not hurting anybody else. The fact of it is we're hurting everybody around us.
It's a secondhand disease. It really is.
We're hurting everybody around us. So it's very important to get the families involved, the parents involved. So every client that comes into us, our clinical director and one of the therapists, we make it within the first week to certainly get a hold of the parents, talk to them. We do groups with the individuals, with the clients and the therapist and the parents. And then every Saturday, not every Saturday, once a month on Saturdays, we also do another group. We have the parents come. It's both parents and the child, and the client gets to come with them. And those are very powerful groups, and oddly enough, the ones that it really made sense to when we do these things that I see the most help are the fathers.
Really?
The dads, they get to kind of see what's going on. They don't get to feel alone. And you're sitting in a group with 15 or 20 parents, and you have their children with the 15 or 20 young adults, men and women, and they can see the similarities, and they feel it's a healing process for them, because as a parent myself, you know, what happens is we blame ourselves, you know.
Mm-hmm.
My daughter or my son is an alcoholic or something, drug addict, and it must be something that I did. You know, we take that blame on, so we're able to show them that it's not, that there's a physical disease, and coupled with it
And the power of being with other families. You know,
the power of being with other families.
Not feeling so alone.
Much more powerful than I thought it would be. Like I say, and the fathers, you know, they break down, and they get to, because they get to see what other families are going through, the exact same thing. You know, when I went into treatment myself, I had a wonderful therapist, and they drew something on the board, and they said about a family disease, and they drew this circle with the alcoholic, and they said I'm the alcoholic, and what happens is the dynamics I have with my family is that I come home, I get drunk during the day, and I come home every night, and I scream at the wife, and I go and tell my daughter has to do homework with me, and she wants to do homework, and I say, sure, I'll do that, and I don't do it, and I go over and I kick the dog, and then I go to my son, and he wants to play ball or have some fun and time, and I don't do any of that because I continue drinking and get drunk. When that changes, when that dynamic of me changes back into that family, they're used to me screaming and not doing the homework,
mm-hmm.
and kicking the dog. So that part has to change too, you know, that
Right.
they have to understand that. So I need to be even more cognizant and aware that, you know, because when that happened, it's amazing that I am doing homework with them, or I am
mm-hmm.
not screaming at them, you know, and my life changes, so their life has to change too. It's a family disease.
Well, you were unavailable, and now suddenly you're available.
Right,
and they're like, now
and
what
everybody
do we do?
used to be being
unavailable.
Yeah, unavailable, right?
Yeah, sometimes it even worked for them. As painful as it was,
Absolutely.
it sometimes worked for
It
them.
all worked for
And
them.
that's when you really have to support the family. So what would you say if a family member was listening to this video right now and is in pain?
You just get help. You know, you got to reach out and have the client reach out to us. You know, you got to go to them. You know, it's a disease. I have to remind myself of this all the time too. You know, hate the disease, not the individual. That's the hardest part we have to do sometimes, is to work on. It's, you know, this person is doing this is because they're using heroin.
So they'll say to you, I'm so angry and I'm so hurt. It's like, okay, be angry at the disease, just don't be angry at the person.
Yeah,
Have compassion
and
for
try
the
and
person.
get and draw some boundaries. That's the hardest thing to do, is draw those boundaries and what you can or can't do, you know. And if you draw some of those boundaries, I work with the parents all the time, and they call and they want to get their, the average age of our clients is probably 18 to 29, average age is probably 25, 26.